Good afternoon. Myself, Manish Tadke, Assistant Professor, Dr. Nephrotic Paediatric Foundation's College of Nursing. I am here dealing with you the topic of nephrotic syndrome in pediatrics. Nephrotic syndrome is a specific globular disease, but a cluster of clinical findings. Now here, the prominent features which are there are proteinuria, hypoalbuminemia, edema, and hyperlipidemia. This is particularly an autoimmune process which leads to structural alteration of glomerular membrane that results in increased permeability of the glomerular membrane to plasma proteins, particularly albumin, and because of which the protein is lost through the urine from the body, and it leads to hypoalbuminemia as there is deficiency of protein in the blood. It occurs because of the loss of protein through urine. Now the classification of nephrotic syndrome, there are three types: congenital nephrotic syndrome, primary nephrotic syndrome, and secondary type of nephrotic syndrome. Etiology of nephrotic syndrome. Now the etiology, the first one is primary glomerular disease, glomerular nephritis, external causes like multisystem disease, infections like bacterial or viral or protozoal, or it can also occur because of the allergy. Pathophysiology of nephrotic syndrome. First, because of all the etiological factors, the damage to glomerular capillary membrane, occurs, because of which there is loss of protein, loss of albumin through urine, which leads to hypoalbuminemia, and it causes decreased oncotic pressure, and which leads to the generalized edema as the fluid shifts from the intravascular space to the interstitial space, and it gets accumulated beneath the skin, which leads to generalized edema. And the kind of edema we will be dealing with the clinical features. The kind of edema is pitting edema. It also leads to facial puffiness. The fluid accumulation takes place under the eyes, which is called as periorbital edema. Facial puffiness is also a part of the fluid shifts from the intravascular space to the interstitial space. Because of there is decreased oncotic pressure, a compensatory mechanism occurs which leads to the stimulation of synthesis of lipoproteins, and which leads to hyperlipidemia. The cholesterol level, or the serum cholesterol level, it increases. Clinical features of nephrotic syndrome. Child will present with the periorbital edema and facial puffiness. Edema, it will be minimum or massive. Profound weight gain within a short period of time, and dependent edema develops in the ankle, feet, genitalia, and hand. Edematous part is soft and it fits easily on pressure. As earlier said, the edema is kind of pitting edema. Striae may appear on the skin. Now this is a picture of a child suffering with nephrotic syndrome and showing facial puffiness and periorbital edema. An 8-year-old boy with the nephrotic syndrome. And now here we can see facial puffiness, periorbital edema, generalized edema, and ascites. The fluid accumulation has also taken place in the peritoneal cavity. Now, clinical features: fluid accumulates in the body space, resulting in ascites, pleural effusion between the pleural space in the lungs. Also, the fluid accumulation can take place, which is called as pleural effusion, where the respiratory distress will occur. Generalized edema will also be seen, as the fluid is not there in the muscular space. The urinary output will be reduced as there is less supply of blood towards kidney, the urinary output will decrease. It is called as polyuria. GI disturbances will occur because of the fluid accumulation in the peridural cavity, and those GI disturbances are vomiting, loss of appetite, and diarrhea. Other features will include fatigue, lethargy, pallor and irritability, hypertension, hematuria, and hepatomegaly, and wasting of muscles may be found in some cases. Complications like ascites, pleural effusion, generalized edema, which is also called as anasarca, coagulation disorders like thrombosis. Thrombosis is occurring because of the compensatory mechanism occurring because of the decreased thrombotic pressure and hypoalbuminemia, the increase in the serum lipoprotein level. So it leads to the complication like thrombosis. The recurrent infections are the child is prone with recurrent infections with bacteria or any protozoa or viral infections. There will be growth retardation, calcium and vitamin B deficiency, protein energy malnutrition. As there is loss of appetite and the GI disturbance is there, the protein energy malnutrition can happen. Investigations are required for what is the WBC count, the hemoglobin level, blood urea level, serum protein, serum creatinine, serum sodium, and serum potassium level. Prothrombin time is to be checked. Then the activated partial thromboplastin time needs to be checked. Urine albumin level, urine pus cell, and urine RBC. Investigations like ultrasonography of abdomen, as there can be hepatomegaly, the problem of ascites is there. Then X-ray test is required to investigate if there is pleural effusion. Venous color doctor is required if there is any chance of thrombosis. Medical management mainly deals with steroid therapy of prednisolone. For children, they receive 60 mg per meter square per day, or 2 mg per kg per day. Maximum steroid dose is up to 80 mg per kg for 4 weeks. It should be discontinued slowly to avoid complications of steroid withdrawal, and alternate daily prednisolone over 6 to 8 weeks should be given. The patient which responds to the steroid therapy, the response will be as follows. There will be steroid sensitivity, steroid dependency, or steroid resistance. The alternative drugs as immunosuppressive agents like cyclophosphamide, cyclosporines A, and tacrolimus are required. And intravenous infusion of albumin, 25% is required, as there is protein loss through urine and hypoalbuminemia. Diuretic therapy in combination with intravenous albumin is required. Steroid therapy used for patients. Now, in the first episode, tablet Visalol daily regimen for 4 weeks is recommended. Then alternate day regimen for 6 weeks, and then it is stopped. Alternation it is started again with the tablet Visalol, and in the second episode, tablet cyclophosphamide, the immunosuppressant agent is given, and in the fourth episode, tablet Visalol, and it is continued till the further days. Now, for avoiding the infections, injection of the broad spectrum antibiotics like injection taxine, or the intravascular injections like vaccine, or painkiller like methotrexate, and the anti-thrombotic agents like warfarin has to be given. Anticoagulation agents like warfarin should be given to the patient. Now, dietary restrictions are there, as there is generalized edema, and The fluid accumulation is taking place underneath the skin in the interstitial space. Short restricted diet should be given to the patient. Protein-rich diet because of hyperlipidemia is there. And fat-free diet as there is hyperlipidemia, high cholesterol, serum level is there. And fluid restriction is recommended up to 1.5 to 1.75 liters per day. Assessment of weight on daily basis is very much important, and maintenance of input and output chart is required. Complications like peritonitis because of any bacterial infections like streptococcus, any pneumococcal or Escherichia coli, and hemophilus influenza or gram-negative bacteria like infections like septicemia or staphylococcus aureus carica. Thrombosis is one of the complications of hyperlipidemia, and the acute renal failure can also occur. Dealing with the nursing management of nephrotic syndrome, it leads to fluid volume access as there is shift of the fluid from the intravascular space to the interstitial space, and the patient is suffering with generalized edema. So fluid volume excess related to edema, fluid accumulation in the tissues. Now we have to assess the intake and output of the child. We have to assess the weight of the child on daily basis. Then we have to measure and record what is the intake and output accurately within 2 hours. Then assess changes in the edema and measure abdominal curve at the umbilicus level every day. And monitor edema around eyes and dependent areas every day. And now what is the degree of pitting and color and texture of the skin is noted every day. Now administer the medications like tablet prednisolone 55 mg, BD and tablet Lasix per week. Lasix is a drug which is given to have the diabetic effect. It is a kind of fluid diabetic. Imbalanced nutrition less than body requirement related to loss of appetite due to ascites and GI disturbances due to vomiting and nausea. Then the interventions are assess what is the nutritional level of what is the nutritional pattern of the child. Now restricted sodium during edema and steroid therapy is required. Then assess the likes and dislikes of the child. And health education should be given to the mother for supplementary vitamins and iron diet like orange or amla, etc. Now these are the foods which are rich in vitamin C, and they can be given to our infection. Enlisted aid of child parents in formulation of diet. The activity intolerance related to fatigue. The child is suffering with generalized edema, the child is fatigued and lethargic. We have to assess the child's activity status, maintain bed rest because child is CV matters. Now balance rest and activity. Plan and provide quiet activities to the child. Then instruct child to rest when he or she begins. And allow for periods of uninterrupted sleep, rest in between various activities. Discomfort related to pain in inguinal region, iliac fossa and left leg. Now this can be because of thrombosis, this can be because of lethargy. Now assess the level of pain of the child, then provide tablet Noctals 25 mg 3 times a day. Now given comfortable position to the patient, then provide comfort devices, ensure rested sleep, provide proper medication and restrict resistance during rest hours. Risk for infection related to immunosuppression as immunosuppression agents are given to the child, cyclophosphamide and cyclosporine. Then we have to assess the drug therapy prescribed to the patient, provide clean and comfortable bed, maintain personal hygiene of the patient, frequently check the vital signs of the patient, give intravenous antibiotics like vaccine or any other type of broad spectrum antibiotics, then maintain nutrition of the patient. The risk for bleeding related to anticoagulation therapy. Assess the patient in these daily activities. Provide safe and comfortable bed. Avoid cuts and injuries. Maintain oral hygiene of the patient. Check vital signs of the patient. Assess the signs of bleeding in the patient.